All right, folks, this is 4-6 to 4-7. And we're going to talk about is membranes. Now, membranes are made up of epithelial tissue, but they all secrete something as well. So we have four different types of membranes. We have mucous membranes, which do what we say, they secrete mucus. We have serous membranes, which secrete a thin watery solution called serous fluid. And you've already heard of these, the peritoneal serous membrane lining your viscera, the pleural serous membrane lining your lungs, and the pericardial serous membrane lining your heart. We also have a cutaneous membrane, which is basically your skin. Now, you probably haven't thought about your skin as a membrane before, but it does indeed secrete things. It secretes sebum and cerumen and sweat, so it certainly is a membrane. And then we have synovial membranes. These secrete synovial fluid. And the synovial membranes, of course, line your synovial joints. They don't line your fibrous or cartilaginous joints, but they line your synovial joints and secrete a synovial fluid. So mucous membranes, serous membranes, cutaneous membrane, and synovial membrane. These are the four membranes. You can see with the mucous membrane, I secrete a mucus onto the apical surface. All right. Oh, here's a word. This is commonly missed, lamina propria. You're going to see lamina propria all over the place. Lamina propria is a loose connective tissue. You can see an areolar tissue of loose connective tissue. But that is not the basement membrane. And people usually think the lamina propria is the basement membrane. There's the basement membrane. Remember, the basement membrane has a lamina lucida made by the cell above it, and a lamina densa made by the fibroblast below it. Well, where do fibroblasts exist? Connective tissue proper. And is loose connective tissue a type of connective tissue proper? You bet. And areolar tissue is a type of loose connective tissue. So that's the mucous membrane. Then you have serous membranes. And serous membranes have simple squamous epithelium we call mesothelium. And the mesothelium here secretes a serous fluid. Now, pathologically, there's two types of serous fluids. There's a transudate, which is an abnormal amount of the serous fluid, and there's an exudate, which is a fluid secreted and infected with bacteria or virus. So an exudate has a bacteria or virus characteristics to it. And what do I mean by characteristics? Well, whenever we fight off an infection, certain things happen that you'll learn in chapter 22. And the exudates will have a whole bunch of these white blood cells in it, and they'll be cloudy, and they'll be fighting off the bacteria or virus. So a transudate is a word that just means an excess amount of the fluid, and that's not good. It's not like that's a good thing. But that's a transudate. And an exudate is excess amount that's infected. It's an infected disease. When the lab gets the transudate or the exudate, because the doctor might have to pull some off, what we do is we look at the color and clarity, and the color and clarity pretty much tell us if it's transudate or exudate. So clear and colorless for transudate, and cloudy and different colors for the exudate depending on the infection. All right, the cutaneous membrane is simply the skin, which is the next chapter. The epithelial cells, like always, are going to have a basement membrane right in here. It's going to be a basement membrane right in there. And underneath the basement membrane, there's areolar connective tissue, just like in the lamina propria up here. And then there's dense irregular connective tissue below that. And that's kind of unique to the skin, but dense irregular connective tissue, recall, is found making up perichondrium and periosteum and capsules of organs. So just recall that. And then lastly, synovial fluid. Synovial membranes secrete synovial fluid. This is hyaline cartilage right here, lining the ends of your bones. And the synovial fluid is secreted by the cells of the synovial cavity here, and probably even some from the chondrocytes there. The synovial fluid is slippery, And as you can imagine, that's important so the bones slide past one another without pain. Okay, this mucous membrane blown up. You can see the cells, the basement membrane, the lamina propria. You can see the mucus. This cell right here is secreting the mucus. This cell right here is called a goblet cell. This is the serous membrane. We already talked about the difference between transudate and exudate. The serous fluid should be a thin, watery solution. If you secrete too much of it, it's a transudate. If it's contaminated or infected, I should say, if it's infected with a bacteria or virus, it's an exudate. Cutaneous membranes, we'll talk a lot about skin next chapter. And synovial membranes. We talk more about these in chapter 9, I believe, joint chapter. But synovial membrane is part of the joints that lines the joints and secretes synovial fluid. All right. The framework of the body is like this. We make compartments. And actually there's a syndrome called compartment syndrome. And I'll talk about compartment syndrome in a second. But we make compartments in our body. And we make it with connective tissue called fascia or fascia. You can pronounce it either way. So let's move from outside in. The first thing you have is this superficial fascia right here. The superficial fascia is really the subcutaneous or hypodermis. That's what it really is. Now, we actually should not study the hypodermis or subcutaneous with skin. It's not part of the skin. But we always study it with skin. It's always filled with not filled with adipose, but always has some degree of adipose fat cells in it. And most physiology books, anatomy physiology books, study it with the skin. But the hypodermis is not really skin. It's really superficial fascia. So it separates the skin from any underlying organ, like muscles or bones or other organs, like your visceral organs. But let me just say this for the word organ. Every named muscle is an organ. Every named bone is an organ. So organs aren't just the stomach and the spleen. Organs are also every named muscle, every named bone, every named blood vessel. All right, and then after the superficial fascia, we have the deep fascia. And you can have several layers of this. What this does is surround your muscles and your tendons and your ligaments. And very quickly here, in a few chapters more, we're going to be talking about the architecture of bones and the architecture of muscles. And you're going to see that we have this fascia that separates them out from the rest of the body, making these compartments. All right, and then lastly, we have the subserous fascia. Now remember what the serous membranes are. The serous membranes are your pleural. So let me just remind you what the serous membranes are. Pleural surrounding your lungs, pericardial surrounding your heart, and peritoneal surrounding all your viscera, stomach, intestines, spleen, pancreas, etc. So what we have after the deep fascia is we have the subserous fascia. Now actually that doesn't occur in the arm and legs, but it occurs in the thoracic region and the abdominal pelvic region. So it does. We don't have subserous fascia in our arm and legs, but in our thorax and our abdominal pelvic we have it. And this is between the serous membranes and the deep fascia. So those mesothelial cells are protected by the subserous fascia. They don't touch the bones or touch the muscles directly, or they don't even touch the deep fascia directly. All right, so that's compartment. Now, what is compartment syndrome? Well, what compartment syndrome is when you have a damage to something. Usually it's your lower leg, but it could be other places. Let's say I damage something right in here. There's damage right in here, and I bleed into that. Well, the swelling has nowhere to go because I have this deep fascia that's pretty tough material. So this swells and it compresses on nerves and arteries and veins. And there's nowhere for that pressure to go because it's contained by this fascia. And this is called compartment syndrome. Now in big muscles or broad flat muscles, it's tough to get compartment syndrome because they are so big. It would be tough to get compartment syndrome in your thigh But down in your tibia, in your tibialis anterior area, your lower leg, it would be easy to get compartment syndrome because you have very little muscle tissue on the anterior side of your shin, and your calf muscle, your gastrocnemius and soleus on the back, isn't enough to really absorb a lot of inflammatory fluids. So we get compartment syndrome in our lower leg quite often. When you do have compartment syndrome in your lower leg and it pinches your nerve, you get this thing called foot drop. And by the way, if you ever have damage to your lower leg and you can't pull your toes back towards your thigh, back towards your shin, you got to go to the doctor. That's foot drop. Your foot drops down. You can't dorsiflex it, they call it. You can't pull it back. And that's serious. And they'll go in and they'll do a fasciotomy. By the way, a fasciotomy is when you make a little incision into the fascia and you relieve that pressure. That's a fasciotomy. All right, I'll see you in the next chapter.